Just wait for Laura. I think we're missing a local MP who's talking to her residents. Well, no, she does it well. Hey, Laura. Good. I'll just tuck in a bit and then we'll get going. Yes, that would. My goodness. Hey, hello. Well, good morning. Welcome to our 26th Town Hall Health Crisis meeting. And these meetings are designed for two things. The first is to give individuals the opportunity to put their case forward, people who have waited too long on surgeries, who've been denied the opportunity, and we've had some great wins for individuals. The second is to help heal the Queensland health crisis and make sure that the government understands that there is a whole heap of Queenslanders who are currently being failed by a system that has been poorly planned and has had 7 years of crisis in the making. As a result of these meetings that both Ros and I have done, we have put forward solutions and we want the government to start listening. And they include better resources, better triaging, sharing data in real time, but above all putting doctors and nurses back in charge. It matters to Queenslanders to have a world-class health system. It matters. It matters because it might be your child having an asthma attack, it might be your dad having a heart attack, it might be grandma who's fallen on the floor. But it is absolutely critical that we heal the Queensland health crisis, and that's why we'll continue to do these. We know the government doesn't like us doing them, but we're doing them to give Queenslanders a voice. Now, before I hand over to both Ros as well as local MP Laura Gerber, I just want to make a comment on the satellite hospitals that we've heard of today. I'm deeply troubled by these reports. It shows that at a time when the government was warned by health experts not to call them hospitals, they did so in a bid to hoodwink people before an election. Now, I don't know, but there's a lot of questions that need to be answered today. The government continues to put its political survival ahead of patient survival, and this is troubling. Queenslanders deserve honesty and transparency, and to know that in the shadows of an election, the government deliberately avoided taking health advice to try and hoodwink people into voting for them is deeply troubling. I'll ask Ros to say a few words. Good morning, Ros.
Ros Bates, Shadow Minister for Health and Ambulance Services and Registered Nurse. Queenslanders deserve a world-class health system no matter where they live, and make no mistake, Queensland Health was in trouble long before COVID. The residents of the southern Gold Coast deserve a world-class health system, and what we're seeing here is on the Gold Coast that ambulance ramping is increasing. At the Gold Coast University Hospital it's 47% and at Robina it's 46%. Yesterday I was at Mackay for a forum that the Health Minister put on to supposedly explain what happened with the debacle at the Mackay Base Hospital. What happened though was that women who were victims were re-traumatised, and they were absolutely disgusted with the Health Minister. In fact, some of them were actually calling for the Health Minister to step down. I want the people of Mackay and the mothers of Mackay to know that we will not stop until we have answers, and we certainly will make sure that no women fall through the cracks and that anybody who deserves compensation gets that. On satellite hospitals, these are nothing more than multi-purpose health centres. There is no overnight beds, there is no emergency department, and my concern as a registered nurse is that if you're a mum with a child having an asthma attack or your husband's having a heart attack and you go to one of these so-called hospitals, there is no emergency department. Precious minutes will be wasted while an ambulance is called to transfer you to either Robina or Gold Coast University Hospital. As I've said before, these are just a method which the government used to get themselves re-elected and hoodwinked the locals, particularly here on the southern Gold Coast. Yvette Darth is a fraud, a phony and a failure, and if Anastasia Palaszczuk hadn't checked out, she would have sacked her incompetent, embattled Health Minister yesterday. Laura.
Thanks, Ross. Thanks everyone for coming today. I'm really pleased that we're able to hold this health crisis town hall meeting here on the Southern Gold Coast today, because on the Southern Gold Coast we are experiencing some unique health concerns. We know that the Tweed Hospital will be closing down next year, and almost 1 in 4 patients that present to the ED there are Queenslanders. Where are all of those Queenslanders going to go when it closes down? We know the Gold Coast University Hospital and Robina Hospital are already at capacity. And then we have this Gold Coast, the Tugun Satellite Hospital, which isn't a real hospital. If those people that would otherwise go to the Tweed Hospital turn up to the Tugun Satellite Hospital, there is going to be a tragedy. We have been deceived into thinking that's a hospital because it's not a hospital. There's no ED, there's no overnight beds, there's no operating theatre. We need to make sure that on the Southern Gold Coast we have the health services that our community deserves, and right now we're not getting it from the state government. So I'm really hopeful that out of this forum today we'll be able to listen to some of the concerns of locals, we'll be able to help address some of their health issues, and we'll be able to fight for the health care that the Southern Gold Coast community needs.
I guess what are some of the things you're hearing from the people in your electorate about health?
Yeah, so they're really concerned. It's not just about the Tugun Satellite Hospital not being a hospital. It's not just about the Tweed Hospital closing down and then not having an ED to go to anymore. It's also the hospital waiting list. There are people that are on the waiting list for the waiting list. They're not able to get the surgeries they need. That is a really big concern for locals on the Southern Gold Coast. Robina ED is already at capacity, and Gold Coast University Hospital, as we know, is struggling. So it's a really big concern that we're not going to have an emergency department to present to when 1 in 4, almost 1 in 4 people are Queenslanders that present to the Tweed Hospital, and they're all Southern Gold Coasters. That is all Currumbin and maybe a little bit of the Burleigh electorate. So it's very concerning for us.
This CT scanner was promised 2 years ago. Robina is a ED department that's under stress, and they have needed a CT scanner for many years now. So it's a little bit too little too late, but that will be a service that will be good for Robina. It means that patients don't have to be transferred either to a private facility to have a CT scan like a John Flynn Hospital, or sent back up to GCUH. Ambulance ramping up there only occurs because there's bed block. There is bed block in both of those hospitals, and there is no new beds coming online for the Northern Gold Coast until 2027. Thanks, David.
Good. Good. Thank you. Thanks, everybody. Thanks very much. Oh, no. Sorry, Jordan.
Obviously, housing starts tomorrow. I guess what are you hoping?
The Deputy Leader will be standing up in Brisbane to outline some things later on, but I'll make some points about that. Tomorrow's summit has to be an exercise in listening and taking responsibility from the state government. If you look at land lot approvals over the last 7 years, they've fallen by 27% in real terms. Now that has created a feeding frenzy, particularly at the lower end of the market. So the solutions we're putting forward include more social housing, more community housing, but also better infrastructure delivery to open up new land lot opportunities. If you do that, you give people an opportunity to enter the market. Now that's been missing. Now we knew that Queensland's population was going to grow, and yet a lack of planning has delivered 27% less lots than what should have been delivered. That is the reason why there is a feeding frenzy in the market. So the solutions we put forward: more social housing, more community housing, but more infrastructure to open up opportunities for new land releases. That's the way that we can heal the housing crisis.
Obviously, the Gold Coast, the peak body came out saying it's a rental emergency yesterday. The Gold Coast is expected to feature heavily in the summer.
Yeah.
Being a local there, how concerned?
Every day we hear from someone who's falling through the cracks on the Gold Coast. Every day we hear of another family who are wondering where they will go when their lease comes up. Every day we're hearing about people who are under pressure making their interest repayments. It is a serious situation, and the best thing we can do as a state is to acknowledge that and allow the councils to plan for land delivery. Now, I'm troubled to hear reports today of the local government authority saying they are desperately waiting for the state government to approve a plan that's been on the minister's desk for far too long. Good state governments work with councils. What we're seeing now, though, is without a federal government in Canberra that the state government is able to trade political barbs with because of the change of colour in government, their attention is now turning to councils. Now, it can't be that every council in Queensland is doing something wrong. The one common theme is the state government isn't listening to communities and they're not listening to councils. And by not approving town plans, that reduces the opportunity to deliver more land and more units in the area where the communities want to see them. The state has to start listening and has to stop fighting everybody just for their own political survival. And that starts with listening to the approvals that councils are desperately seeking. I hope so. And I'm going because I want to be part of the solution, but I'm going to make sure that the state government actually listens and accepts that the responsibility for the housing crisis rests at their feet. Now, if the state is serious, they will listen to the solutions on the table tomorrow. This can't be an exercise in pointing the finger at everybody else. We have to get this right. We have a generation of working Queenslanders who are struggling to keep a roof over their head. We have people who are living out of their cars and then going to work during the day. That is not a modern Queensland. Working people are falling through the cracks. People who are disadvantaged have got no hope of getting a social house over their head, and young people who want to get into the market have never found it more difficult. There has to be solutions the state government accepts and embarks on, and that starts with accepting responsibility, and it starts with listening to what's on the table. Thanks very much. See you guys. Thank you.